Hi, my name is Kamala Hastings. I am a 29-year-old trans woman. I am making this video to educate and inform other people about transgender awareness, transgender rights, transgender issues, and things that transgender people generally deal with. I've had 2 other videos I've done. I hope that this video can be informative to you. The first thing I'm going to talk about is, when do you start HRT? Excuse me. To answer that question, I recommend seeing a gender therapist. And the reason I do is simple. Transitioning hormonally is a life-changing event or circumstance if you're not prepared for it. With that being said, being prepared for it is something that takes years. And I knew I was trans since I was a child. So it wasn't a question of being ready for it, but it was about being prepared. Hormones will make you grow breasts. Hormones will change the way your body looks. That's irreversible. So if you change your mind after doing it for 5 or 10 years, it's going to be really difficult to go back to the opposite sex. It's like going through another transition again. I have a friend who recently detransitioned and quit it. They have their own reasons, most of them religious pressures and family issues, and also mental health issues at hand that coincide with his decision, formerly his decision to detransition and to engage in spirituality and other spiritual events. But that isn't what I'm here to talk about. Although detransitioning does happen, it is more of an anomaly. I speak about transition in terms of my transition. I have no medical I'm not a doctor. I have no medical documents to back up any assertions that I state. But everything that I do say, I say from my own experience. And I think that being a trans woman, transitioning for 10 years, and having some time under my belt, I would recommend anybody that's new to transition, something simple, is just take your hormones and see what happens. That's all you can do. And wait, and wait, and wait, and wait for results, because it doesn't happen overnight, over a month, over a year. It takes a couple years before hormones can really change a male to female, transsexual. Pardon me, I have a bit of a cold. But the transgender community sometimes has issues with the other LGB community, and sometimes the LGB doesn't want the T included for various reasons, mainly transvestites in the 80s during the AIDS epidemic, giving the gay population maybe a negative image of transvestites or transgender people who were improperly represented during the early 80s. If you do research, you can see that that is inevitable. The reason I'm making this video is just to explain that how life-changing transitioning is. It completely changes your life. Do you want to do it? That's up to you. Is it worth it? Well, for me, I would say it was. And the reason I say that is because I dealt with feeling incongruent with my own body and most of my life until I was 20 and started taking testosterone blockers. I started estrogen shortly after. I think that it's important to see a gender therapist. I think it's important to work with the medical community and see what outcomes and treatment plans work best for you. And some people are happy just cross-dressing at home, or some people have to have full gender reassignment surgery to feel comfortable in their own body. Everybody's transition is different. I'm trying to keep this video short and sweet, but I'm trying to make a point. The point I'm trying to make is you have to be sure you really want to do this before you embrace it. Because if you go into it blindly, there is a chance that you may make regrets, that you're irreversible, and you may never be able to change. You may permanently be stuck with man boobs. You may be permanently stuck with no facial hair if you want to grow out a beard, if you decide to detransition, if you'd have your facial hair removed. If I was to detransition, it would be like life-altering because I've had all my facial hair removed, facial feminization, and I have larger breasts. So those statements make me more feminine looking, and it's hard to hide that. So I made this video, and I'm going to conclude with one thing. And the one thing I want to tell you is I'm not a doctor, so I cannot give you medical advice, but I recommend gender therapy. Your first few years are going to seem like they take forever, but they'll actually seem like they passed quickly when you look back 5 or 10 years later on them. That's true for me, at least, and true for a lot of trans friends who have been transitioning for at least a decade. It takes years and years and years to learn to live as the opposite sex. It's not something you learn in a 12-month period. You can look a whole lot different in 12 months, but it's a lot of changes that you go through. So I really, really want you to think about what you're doing. If you want to take the hormones, if you don't, if you need to, take them. But I'm not a doctor, and I cannot prescribe or advise you to take them. I can just give you my story. I hope this helps in the transgender experience that I have gone through myself. Pardon me, my voice is getting raspy. I have been sick. So I'm going to end the video, but make sure that you see a gender therapist because that will make your life so much easier. Until later, ciao.